Welcome to the Cavite Squad. On May 22, 2022, the Cavite Squad conducted a knowledge and wisdom about the medical services, rescue operation, military activity, and especially how to save life to the soldiers, people, and etc. Especially this topic is in our nation as Dovest soldiers of God. That's why I give this very crucial knowledge and wisdom about the international activity just like this. These 8 military medical advancements are saving lives. 1. Stop the bleed. In life-threatening emergencies, minutes can make the difference between life and death. Bleeding control techniques such as tourniquet application and packing open wounds with clean gauze, which were once primarily reserved for the battlefield, are now being widely taught to the public through the Stop the Bleed campaign, which trains Americans on how to respond to bleeding emergencies. Early bleeding control is important both off and on the battlefield. Hemorrhage secondary to traumatic injury is the leading cause of death of Americans between the ages of 1 and 46. The Stop the Bleed campaign was launched in 2015 by the White House National Security Council staff. Since then, bleeding control has become widely taught, and bleeding control kits are now commonplace in schools, airports, workplaces, and other locations. 2. ER-REBOA. Military research into bleeding control continues to be a priority, and lessons learned on the battlefield are being carried over to the home front. For example, the resuscitative endovascular balloon occlusion of the aorta, ER-REBOA device to stop hemorrhaging, received approval in 2015 from the U.S. Food and Drugs Administration. The device was designed by Air Force Colonel Dr. Todd Ramosen and Dr. Jonathan Eliasson, who served the tours at the military's Level 3 Surgical Hospital in Balad, Iraq, and saw a need for a device that could stop blood loss in the pelvic area and abdomen. The ER-REBOA is not only being used by the military but also in more than 250 hospitals internationally and has greatly increased patient survival rates. 3. Ocean integration. Advances in prosthetics. Advance in artificial limb technology since 1909-11 have enabled war fighters who lose an arm, a leg, or the use of multiple extremities in Iraq or Afghanistan to function better. On December 7, 2015, 2 amputees who were Iraq and Afghanistan veterans, Brian Jacobs and Ed Salau, became the first Americans to get a percutaneous osseointegrated prosthesis or POP implant through a clinical trial funded through the Department of Veterans Affairs. While traditional prosthesis involved placing the residual limb into a cup-like shell called a socket, which can cause pain, discomfort, and infection. The POP implants are surgically anchored into the patient's remaining thigh bone to allow connection to the prosthesis. Patients report a number of benefits, including improved mobility, improved comfort, a decreased risk of falls, and a more part of me experience compared to socket prosthesis. In 2020, FDA approved the Ocean cord prosthesis for the rehabilitation of amputees implant system. The first implant system approved is specifically for adults who have above the knee amputation for MATC training, prolonged field care to prepare for further battlefields where there is limited ability to quick evacuate a patient to a higher level of care. The Medical Education and Training Campus Combat Medic Specialist Training Program in San Antonio, Texas has developed an introduction to the lead evacuation care component to its capstone combat field training exercise. The goal is to expose the Army's point of care medical personnel, the 6-8W Combat Medic Specialists assigned to the U.S. Army Medical Center of Excellence to the principles of prolonged field care. The pilot program launched in June 2021 aims to better prepare medics for near-peer conflicts when immediate medical evacuation may be difficult. 5 Biology Hemming Simulation Center and the Uniformed Services University of the Health Sciences. Recent wars have demonstrated the need for more training and practice on life-saving procedure on the battlefield. Using the simulation for training military medical personnel dates back to the 1960s. In 1999, the Biology Hemming Simulation Center at the Uniformed Services University of the Health Sciences in Bethesda, Maryland, was created through the vision of the Dean of the School of Medicine, Dr. Val Hemming. The center uses live actor simulation, mannequin task trainers, and virtual reality to help train medical students, graduate level nursing students, and graduate medical education trainees. The center is one of the largest and most comprehensive simulation center in the MSS. In 2005, the Army established the Medical Simulation Training Center MSTC program with the goal of building and standardizing the skills of Army combat medics. However, the MSTC did not include physician and nurse training. In turn, the MS initiated the establishment of hospital and school-based simulation center to enhance clinical training and experience among the doctors and nurses. 6. Quick clot and controlled bleeding is the leading cause of preventable death on the battlefield. Increased use of tourniquets and hemostatic dressing, which clot the blood inside the wound, have saved the lives of many seriously wounded service members. Soon after the attack of September 11, 2001, the Defense Department launched a series of studies to identify the most effective technology. Quick clot combat gauze has been used by the U.S. military in operation in Afghanistan, Iraq, and Syria. This type of band-aids uses a compound found in the exoskeletons of shrimps and lobster that helps form blood clots. 7. MHS application apps. The military health system is more than just a large health care institution. It is also a community. Over the years, the MS has developed a series of apps to provide the community, including patients and healthcare provider and staff, with information on practical, easy-to-use healthcare mobile application. They range from application to help with the relaxation and breathing to immunization, reference material, and tools for evaluation and treatment of concussions. The goal of the application portfolio is to help improve the quality of services provided to MS patient providers and staff, to ensure they have the information technology products available for all their needs. At least of available apps can be found at the bottom of the Solution Delivery Division's webpage on Health Mail. 8. MHS Center of Excellence. Military Health System Center of Excellence, or COS, were established to help the Department of Defense to speed the advancement of our scientific knowledge and evidence-based practices for diagnosis and treatment of disease and conditions that impact our military personnel and their families. With the help of a critical mass of experts, the following are a list of MHS COAS: Consortium for Health and Military Performance, Center for Neuroscience and Regenerative Medicines, Defense and Veteran Center for Integrative Pain Management, Extremity Trauma and Amputation Center of Excellence, Hearing Center of Excellence, Immorta Cancer Center, National Intrepid Center of Excellence, Psychological Health Center of Excellence, Traumatic Brain Injury Center of Excellence, Vision Centers of Excellence.
Ikaw at ako ay mga mandirigma. Ikaw at ako lalaban sa ngalan ng pag-ibig at kapayapaan. Matapos umahon sa pagkatabating uurong sa gera ng buhay, isa kong sundalo, kawal ng bathala, mabuhay, mamatay, ito ang magpapatunay sa pag-ibig ko sa buhay na sa akin ay binigay. Dalangin buong puso, biyang kulay at tagumpay, at kahulugan ng pagiging tao sa mundo. Kahulugan, ikaw at ako ay mga mandirigma. Ikaw at ako lalaban sa ngalan ng pag-ibig at kapayapaan. Naniniwala kakaisa, lalaban sa ngalan ng pag-ibig at kapayapaan. Matapang, walang uurungang daanan, harangan, mandi bibitawan, hawakan mo lamang, di ka iiwanan. Buo ang kalakasan sa pagsasamahan, di matitinag, aninag at nababanaan. Pagsikat ng araw, pagsubok ay papanaw. Ang hirap ng ating pinagdaraanan ay may kahulugan. Ikaw at ako ay mga mandirigma. Ikaw at ako lalaban sa ngalan ng pag-ibig at kapayapaan. Naniniwala kakaisa,
Pilipinas, lupain ng ginto't bulaklak, pag-ibig na sa kanyang palad, nag-alay ng ganda't dilag. At sa kanyang yumi at ganda, dayuhan ay nahalina. Bayan ko, binihag ka, nasadlak sa dusa. Ibon mang may layang lumipad, kulungin mo at umiiyak. Bayan pa kayang sakdal dilag, ang di magnasang makaalpas. Pilipinas kong minumutya, pugad ng luha at dalita. Aking adhika, makita kang sakdal laya. Kulungin mo at umiiyak. Bayan pa kayang sakdal dilag, ang di magnasang makaalpas. Pilipinas kong minumutya, pugad ng luha at dalita. Aking adhika, makita kang sakdal laya.
Sundalo ng Diyos, kailanman ay hindi matatakot. Kahit na saan man dalhin, ang utos niya ang susundin. Dahil ako ay sundalo, sundalo ng Diyos. Ay sundalo ng Diyos, kailanman ay hindi matatakot. Kahit na saan man dalhin, ang utos niya ang susundin. Dahil ako ay sundalo, sundalo ng Diyos. Baluti ko'y pagkamatubig, kalasag ko'y pananalig, panyapak ng pagiging handa sa paghayag ng salita. Helmet ng kaligtasan, tabak sa pakikilaban. Ako'y walang katatakutan, dahil ako ay sundalo ng Diyos. Ako ay sundalo ng Diyos, kailanman ay hindi matatakot. Kahit na saan man dalhin, ang utos niya ang susundin. Dahil ako ay sundalo, sundalo ng Diyos. Baluti ko'y pagkamatuwi, kalasag ko'y pananalig. Panyapat ng pagiging handa sa paghayag ng salita. Helmet ng kaligtasan, tabak sa pakikilaban. Ako'y walang katatakutan, dahil ako ay sundalo ng Diyos. Helmet ng kaligtasan, tabak sa pakikilaban. Ako'y walang katatakutan, dahil ako ay sundalo ng Diyos. Dahil ako ay sundalo ng Diyos. Dahil ako ay sundalo ng Diyos.
Bilang kawal ng bayan, paglilingkod sa amin nakaatang. Aming poprotektahan ang bawat nasasakupan sa mga humadlang sa ating kapayapaan. Kami ay nakahandang ipagtanggol ang ating bayan. Suporta ng bawat isang kailangan upang manatili ang ating kasarilan. Kami gawan ng hukbong katihan, layuning magtaguyod ng kapayapaan. Kami sandigan ng bawat Pilipino, makikisa tungo sa kaunlaran para sa inang bayan.
Kami ay nakahanda sa anumang pagsubok.